Preeclampsia Management and Pregnancy by Tiffany R. Reel, Western Governors University, LUT 1, student ID 000438587. Preeclampsia is a hypertensive disorder of pregnancy. It is the most prevalent pregnancy complication and affects 2 to 8% of pregnancies worldwide. It is the highest factor affecting both maternal and fetal deaths worldwide. Preeclampsia may present at any gestational age, but is most often diagnosed in the third trimester. Although preeclampsia is relatively common, it can be extremely serious. Over the last several years, significant progress has been made in developing tests and procedures that predict the risk of preeclampsia in a woman. New understanding behind the pathophysiology of the disease may lead to even earlier testing. Early diagnosis and management of preeclampsia has been proven to decrease both infant and maternal mortality rates. Management of the mother with signs of preeclampsia may be done numerous ways. If the woman is not managed, preeclampsia may turn into eclampsia, which is an obstetrical emergency, and increase the risk for both maternal and fetal mortality. On the visual aids that I will show, one is the representation of the number of pregnancies that preeclampsia affects, the 2 to 8%. One is the percentage of preterm deliveries that are prior to 37 weeks due to preeclampsia, and the other is the maternal and fetal death rates worldwide. Those rates are 9 to 26% for maternal deaths. 15% of all preterm deliveries are secondary to preeclampsia. Those percentages are the equivalent of 70,000 maternal deaths and 500,000 fetal deaths per year. This is the first graph with those percentages. The next visual aid that I will show is actual diagnosis and a guideline that goes over diagnosing and then treatment of preeclampsia depending on the patient. Preeclampsia is defined as a hypertensive disease of pregnancy. It is a challenging disease to identify because of the disease process. It may affect the liver, kidneys, brain, and lungs. Research suggests that the earlier a diagnosis of preeclampsia is made, the better the outcome for mother and infant. Because preeclampsia may be a factor leading to seizure, pulmonary edema, placental abruption, oligohydramnios, which is low amniotic fluid, and fetal growth restriction, the earlier it can be detected, the better the outcome. This is a direct reference from parentheses English F.A., Kenny L.C., and McCarthy F.P., 2015, page 8. Several key factors contribute to diagnosing preeclampsia early. Patients with an already elevated blood pressure, chronic hypertension, protein in the urine, headaches, blurred vision, upper abdominal pain, and unusual swelling may be monitored more closely for preeclampsia. Effective management of preeclampsia can be divided into 3 categories: prevention, early detection, and management. Preeclampsia is best managed on an individual basis and depends on the judgment of the physician. These are the other graphs that go over diagnosing and what to do. Once a plan for management has been established, the patient must stick to the regimen. In some cases, this management is not enough. Delivery would be the last option and last resort, depending on gestational age of the infant. Here's the last graph. In conclusion, research suggests that early detection and management of preeclampsia may improve maternal outcomes by decreasing the risk of developing eclampsia and maternal and fetal death rates. Preeclampsia is an unpredictable disease with research constantly evolving, and with no effective method of prevention, The best line of defense is the earliest detection and management. I have a couple of audience questions here. Question number 1, if I had preeclampsia with my first baby, will I have it with my next pregnancy? The answer to that is yes, there is an increased risk for you to have preeclampsia with a second or third pregnancy if you had it with a first. Sometimes that can even be more significant in a second pregnancy. If you developed preeclampsia with your first pregnancy at, say, 24, 25 weeks, it may present even earlier with a second pregnancy. Those factors also depend on if the father of the baby is the same and a couple of other things. But if you had it with a first pregnancy, you'd be closely monitored. Your urine would be dipped at every prenatal visit and your blood pressure checked often. Question number 2, is there a cure for preeclampsia? There is no definite cure except for delivery of the baby, regardless of what gestational age a mom is. If she is getting sicker by the minute and there seems to be no other way, then delivery of the baby is the only cure. Mom would still have to be managed afterwards with sometimes medications and bed rest and those sort of things. But it is no actual cure other than delivery. Question number 3, are there special activities that I can and can't do? There sometimes are. That depends on what your management is once you've gotten the diagnosis of preeclampsia. Sometimes it's just a modified bed rest. Sometimes it's light activities. Sometimes it's complete bed rest. Those would be the decision of the physician and how your disease process is progressing and how your blood pressures react to certain activities and not to others. That's the conclusion for preeclampsia management in pregnancy. Thank you very much.